Every time I go to a conference, there are always new tests that are out on the market. And a lot of these tests are marketed direct to consumers. But the problem is this can be very overwhelming, not just to consumers, but also to physicians as well. What do I make sense of these tests? How are they validated? And the most important thing that you learn when you're an internal medicine resident and in medical school actually in general is, how is this test going to change my management? If the test is not validated, if the sensitivity and specificity are not at the level where we actually trust the test to make a diagnostic and treatment decision, why bother doing the test, right? So we have to be very discerning and very thoughtful about what tests to do and in what settings, right? And so for this, we have some evidence-based guidelines that tell us, okay, how often should we be checking cholesterol panels and metabolic testing and so on. But the reality is that our physiology is changing actually faster than what we can capture in these guidelines. The other piece too is that I would rather capture those tests when I can still prevent a disease and when I can still see that there is a trend. Let's say if I'm working with a patient whose blood glucose levels are creeping up, whose cholesterol levels are creeping up, maybe their inflammatory markers are creeping up. I'd rather be starting to work with that person before they actually present with a fully manifested disease, than once they have that, because it's much harder to manage or reverse disease than it is to prevent one.